Good afternoon, everyone. I will start presenting this webinar, and the first part we would like to present you the testimony ebook that we produced 2 years ago. It was our first edition, and we chose to collect testimonies from children, adolescents, young transferees, and families when their kids were way younger to write. So families to talk about their experience on transplantation. We wanted to share the experience and the points of view of families and children who have been submitted to transplant, and to try to help other children and to address questions of families and patients that are waiting for a transplant, or even to address a message to their healthcare professionals, and to say what could have been done differently and what they regard and are grateful for. So the first part, we can change the slide, please. The first part was that we asked for each center of this TransplantChild network to write a testimony of 5 testimonies from patients or parents, and if possible, depending on the age of the patient, since we didn't want to have a photograph or any identification of the children, they could draw something and we would add the drawing to their testimony. We ask for them to write on their native language, their mother language, and then we ask for the physician to translate. And so we all gather the native language, but every testimony were also in English so that everyone could see and read the testimony. We also ask for a written informed consent so that we could share their insights in their testimonies. So the format that we suggested on the first edition was to write a text of 300 to 400 words, where we chose to identify the patient. It could be a fictitious name or a scientific name or something they would like to add as their identification, to clear the primary disease, the age of the transplant, which were their main concerns and successes, and the message for those waiting for transplant, those already transplanted, and for the parents, caregivers, and health professionals. I'm glad to share with you, we already shared this in other presentations, that we were able to gather 57 testimonies of 7 countries within the 21 that are part of our network. And right now the testimonies is available online. So we leave here the website where you can check and download the testimony. And as you can see, we have it always the 2 parts of the testimony, either in the native language, but also in the English translation as well. The testimonies are, you can see where they are from, so they are grouped by country, and you can see within the country you have multiple testimonies, either from kidney, liver, and multivisceral. So you have a symbol that identifies which type of organ transplant testimony is about. So we were very, very happy that at the end of the collection of the testimonies, we were able to have at least 1 testimony from each organ transplant program. The lung testimony was the hardest to get, and it was almost at the end of the production of the testimonies that we could get 1. But right now, I think it's important to have an experience and show to every patient, regardless of the type of the organ they are going to transplant, that we can offer at least 1 experience. So here you have an example of the structure and the template of our ebook. So we have the native language on the left and then the English translation on the right. So right now, what we want to present you is the 2nd edition of this testimonies ebook. What we thought it would be interesting right now was to change the coin, so flip the coin to see now what the health professionals think, feel, and experience through the years along their experience with transplantation and pediatric transplantation itself. And so we ask them to address some questions, some feelings, some insights of their own, and to help them explain to their patients. We even ask for Patients Association for some questions, and some of the questions that we present as examples are questions that the Patients Association wanted to be addressed. So if their their possibility, they would like to see those questions answered as well. And I think it's important to go where the patients want us to go. So it's important to hear them and to address what they need and their needs and what they want us to tell them. And I think it's really important that we highlight the role not only doctors, nurses, psychologists, and so on, as we are going to see, have on their story. Because, okay, I know they are the principal figure, the main actress and the leaders of their story, but we are also a part on each story, and we would like to address and help them to see what we think, what are our challenges, our successes, and to help a little bit to their story and to make it easier for them to see our point of view.
Okay, so as we discussed already at the board of the network and in other occasions, we felt that we also have to hear what the operators have to tell, because we all understand that working with children in the need of organ substitution through a machine first, maybe for dialysis or for instance, for the Berlin heart, for those waiting for a heart, is a very challenging period for not only for families and children, but also for the operators. And the operators dealing with children and families need to have some special qualities which are different from those required when two operators working with adults. And so we have to share with them all this long journey, starting often before they even born to adulthood. And sometimes this journey is really challenging because we have to face in different roles, so the role of diagnosis, of dealing empowerment of the parents in ensuring the children a comprehensive multidisciplinary care, but often we have to go back to the family and even grandparents to try to educate them in dealing with a chronic disease and a failing organ, and trying also to convince them every day that the battle is worth and that a failing organ doesn't mean a failing life and a failing person. So to strengthen the family and to empower these families to reach the final result. And this is actually a real struggle that you build day by day when you work since many years, but sometimes is really felt as overwhelming because we have to face different tasks, so many. We have to explain, we have to be allied, we have to struggle together with the parents, we never have to give up, and sometimes the feeling is that we really would like to. Then we have to explain what wait list and share with parents that maybe some calls will go to a transplant because maybe for some reasons the organs is not good, and so we have to face also the the delusion or the frustration of not being transplanted that time, also ensure the perfect care because the disease is going on, and to arrive for that precise moment for performing the transplant in perfect condition. So for some children and in some cases, it's very hard. And so many of them are involved also in the care before the transplant. And this is a continuous and daily practice of very challenging. So we have also to educate the people on all the issues of transplantation, and for some children, particularly those at the around adolescence, maybe accepting a cadaveric donation is not that easy, and we have to be ready to answer to their questions day by day. Then we also want to think about the transplant coordinators. So the different situation in different countries and different centers is differently organized. But for most centers, the transplant coordinator is the person who faces the donor and the family of the donor, and have to inform and ask consent for donation. And this is a very difficult task when you're dealing with children and sharing with the family with a dying child and ask for donations. So these persons need to be acknowledged, and also we have to listen to the difficulties sometimes. Then we go to the operating room, we start a new life with the new organ, and then our role changes to educate, and educate again, in never forgetting the pills. And this role is different from doctors to nurses, teachers, psychologists, all together in going on the same purpose, but with different childs. And so we also have to share the joy of a new life, but without forgetting compliance, so to be mild enough but strong enough. And sometimes the battle is lost because things don't go on the right way, even every possible effort. So dealing with all these aspects on this journey together with children and families is very demanding also for the personnel. And so we thought that the personnel dealing with all these journeys should be listened, because maybe we have to tell us many things, and we can share some aspects. To the next slide. The literature, if you go to the PubMed, and it's not difficult it's not very easy and very straightforward to find the proper word to look for this. But if you go directly to the PubMed, you'll see that the problem of personnel is being acknowledged in recent years because of lack of doctors in many European countries, the lack of doctors choosing this life, and also trying to understand that maybe we cannot have the presumption or the assumption to be able to do everything, but also that our institution maybe do not recognize our work well enough. And so many young people are choosing other careers. At least this happens in France, and it happens also in Italy. So on the literature, the French pediatric nephrology sent an alarm because there are many. It's very difficult to find now people wanted to work in this way, because the issues that we have to face every day are, of course, very demanding for the emotional aspects and the professional aspects, but also the quality of life of people working on transplant, which is a 24 hours activity in very small equipes, like in many situations we have, at least for children, means that you have to be on call many times a day, that you don't have time for your personal life, and your children are neglected at the end of the day. And so the new doctors are choosing these activities less frequently than we did in the past. Next slide, sorry. So in the literature, if you go there, you can find also some contributions on the perspective of transplant nurse coordinator. As I said, this is a very special professional condition which is mostly neglected. In fact, in this article says no one seems to see us, because not so many people know that for every transplant program in any institution, there's a transplant nurse coordinator, who is the one, at least in our situation, who takes care of everything is around the donation, starting from informing the parents of the potential donor and explaining them the situation. And this person with a challenge is challenging position, because the people now are very various, are the multicultural, multi-religious orientation. We also experience in many situations an exposure to violence, to verbal violence, and it's becoming quite challenging also for the fatigue and the work-life imbalances, meaning that sometimes for this person it's difficult to explain what they feel, and maybe exhausted quite frequently. Next slide. Sometimes, as I said, the things, even if we try to do all much as best as possible, some diseases are really very complex and very difficult. And so even though we are trying to do our best, the child maybe cannot succeed in going well, and the patient may die in certain situations. And for certain diseases, it is more often. in other in other diseases is less frequent. But anyway, when a child dies, it's always a problem for all the team, and to be able to cope with death of a child is not that easy. And this is also an emotional care which we share with patients and families, with parents and families, and sometimes to try to continue to do this work day by day. We find somewhere, even in parents and in families, the forces to go on. But this is not very, sometimes we are forced even to choose to give up because this is too demanding for us, and personal situations are different. If you work in oncology, maybe it is most frequent, and you have structured how can I say, support or psychological support. In other fields is less frequent, and so maybe you cannot find psychological support or other professional support. Next slide. This is, in fact, what happens for the hematology-oncology literature, the burnout experience of people working in hemato-oncology, in pediatric hematology-oncology. Maybe in your centers you can experience this, maybe not, but the impression is that nowadays things are becoming more complex for the population that we deal with, either because you have a more varied population, more difficult diseases, and children who in the past were just not surviving since diagnosis or since birth. So now we have more children, more complex children arriving in the need for a transplant, more complex families, and multicultural situation. And so the challenges we face, I think, in my career, I think they are more demanding now than it was 25 years ago or 30 years ago. And so even the burnout situation, called as it is as burnout, is becoming more frequently reported. So maybe we can ask ourselves some questions on this. Next. So burnout and fatigue, maybe we can admit that we sometimes face with this situation and try to address these issues altogether, and understand how we can probably sharing this situation, trying to find at least to admit that we have a problem, that we have a fatigue, that we are experiencing exhaustion, and try to put in the field, maybe asking to other colleagues or other centers to see how they dealt with, or how they got organized trying to survive to this problem. So next slide. For all these reasons, and we can speak and look into the literature, we can get many other inputs on this. We decided that we should open to also to healthcare professionals. We all understand that they are continuously exposed to high emotional demands. They face moments of hopes and struggling for life together with the parents and the families. We are allied. We are asked to be allied, supporters, and then become friends and deeply affectionated to these children we bring to adulthood. But at the same time, we must have a sort of boundary to survive in our role without being affected, without taking home what happens at work, trying to maintain our minds, how can I say, brilliant enough to be able to take care of our job, and avoid being overwhelmingly affected in our personal life and personality, so that we can be able to continue in this work. Next. So we decided to launch this project within the TransplantChild European Reference Network, producing an ebook and collecting the testimonies for different healthcare professionals dealing with all pediatric transplantation programs across Europe, regardless of roles, countries, hospitals they work for, because we all belong to the same big team. We are many countries. We are 21 countries. Maybe we can address things in a different way, and we believe that we can find something good to be maybe exploited and imported in our realities from everybody through this project. So we believe that we will continue to address some of the shared situation, difficulties and feeling we all face every day in our jobs, and maybe we can also find solutions or take something good from experience of others, and maybe find also somebody who's really expert in this. We in Italy we call them workup psychologists, but I'm sure that we cannot have in every situation, in every hospital, in every department, a workup psychologist or somebody working on mindfulness or empowerment. These are all words we are starting to know, but I'm not sure if we can all take advantage of this. So the first thing would be first just to be free to tell our good things and bad things, and then see if in the next step we maybe collect also other professionals more specialized in addressing these issues. Next. So now I leave the word to Federica, who will explain how we decided to propose how to organize the collection of these testimonies.
Yes, good afternoon. I'm stepping in on behalf of Dr. Sara Mosca. She had to leave because the situation at her unit was getting busy, so she apologizes. She had to leave. So what we are doing now is what we did for the first version of the project with the testimonies from children and families. So we are asking each center, so we are asking you to collect testimonies from any member of your transplantation teams. When we say any, we mean doctor, nurses, psychologists, therapists, social workers, even the hospital teachers, the dietitians, even the administrative officers and secretaries, because that's one of the aim as well of this project, to involve every type, every role dealing with pediatric transplantation, to give a sense of cohesion and of sharing. We can even say sharing a mission. So what we are asking is for a testimony in your native language. It could be written, it could be audio, like a WhatsApp audio or a recorded message, or even a video message. We said we ask you to do it in your native language because we believe it will be easier for you and for people to express feelings, emotions, and things which can be difficult to be shared. So probably in the native language, it could be easier. We ask also, of course, for you who are gathering the testimonies to collect their written informed consent. Next one, please. So as we did for the testimonies of children and families, we sketched a scheme, let's say, a format of questions, which we propose to you. Because we believe that having a path, a defined path, could be easier in developing your story, your thoughts, and at the same time, it could give unity to the project, because if all the stories follow a precise path, then they can be comparable, and they can find a sort of unified scheme and topic. So we suggest to start stating your role, your precise role. If you want to present yourself with your name, but we don't ask for name and surnames. I mean, the idea behind the testimony is to be universal. So it doesn't matter that the testimony applies to a specific person with name and surname, because those stories are universal at the end of the day. Then we ask for your country, and for the reason I just explained of the universality, let's say, of the stories, we don't ask for the center, or at least we won't report the name of the center in the final book. Then we ask the experience you have in the field. So how many years you have been working in the field of pediatric transplantation, and what type of transplant program you work for. Then when you see P, when you see here the P between brackets, it means that this is a question that the patients, families, even through patients associations, told us that this is a very important question for them. I mean, if they were given the chance to ask the professionals a question, that is exactly what they would ask for. So as Sara said, we think it's important for you to answer this question, because this booklet is for you as healthcare professionals, for all the reasons that Licia has explained so far, but also for the patients who will read your testimonies. So why did you choose to become a healthcare professional dealing with transplants? The patients ask. And how can you combine your personal life with the urgency of a transplant when an organ is suddenly available? That's a very interesting question that came from several patients. And then this is a question that I personally proposed, is what are the main changes over the years in your job? Due to the experience, of course, you have gained through the years, but also thanks to medical and scientific innovations, technological advances, and also, as Licia was saying, we are sure that we are all facing social and cultural changes in society, and it is to say in the patients and in the families you deal with. So let's imagine just the barrier of the language, which is it could be a main barrier with foreigners, but also like cultural and religious issues. Then again, how do you communicate a failing transplant notice? Patients are asking what advice you could give to establish a good relationship between healthcare professionals and patients and families. And of course, I mean, we expected this question. Patients are asking, what are the particular case you recall over the years and why? And then we leave you, I mean, the chance, if you want, to share a message with patients and parents or your colleagues around Europe. So before showing here an example, we want to underline that this path, this scheme, of course, is not compulsory. That's a suggestion from our side to help you structure your testimony and the testimonies you will be collecting from your teams. But of course, nothing is mandatory. So you can organize the speech and the testimony as free as you want. So here we are reporting two different examples. The first one is following exactly this scheme. So it's answering all those questions. Here you can see that we have the native language version, which is Spanish. And then, of course, we translated it into English. But I mean, don't worry, because we can use the EU tool that the European Commission is offering us. So we don't ask for your translation from scratch. So don't worry. And Maria, in this case, decided to share her testimony with a video, as we said, which we want to report you because we find it a nice way to give your testimony. So I will ask Jorge to let the video start, just to give you an idea.
My name is Maria, and I'm a pediatric nurse from Spain. I began working in the field of pediatric solid organ transplants 32 years ago. At first, only kidney and liver transplants were performed. Later came intestinal, cardiac, pulmonary, and multivisceral transplants. I got into transplantation by chance, when they needed a nurse for the pediatric transplant ward. But soon I realized I wanted to keep learning about it. There have been many changes over the years. It's hard to choose, but if I had to pick, I'd highlight the change from cyclosporin to tacrolimus, the accommodation and support of the caregivers with the child, even in the intensive care unit, the program of recreational activities during admissions, support from patient associations, and recently the transition program to help adolescent and young adult transplant patients. The main tool to build a good relationship with children and their families is to listen. Listen to how they feel and what they need. Then we will try to respond to those needs as much as possible. And it is really important to be honest, not offering what we can't provide. It's impossible to pick just one case. There are so many children and families who have left a mark on me. Each one has given me something that has made me a better nurse and a better person. A message for other professionals: let yourself learn. We have a lot to learn from every family we care. A message for parents: trust your children when the time comes. Let them fly. Learn to live with their transplant and be independent. Overprotection doesn't help, it only limits them. And a message for those amazing people who grow up learning to live as transplant recipients. As the song by El Kanka says, look at yourself. Believe it. Step out. Face it. Take it on. Trust yourself. You can do it. Don't let anyone tell you otherwise, because you truly can. Enjoy life and be happy.
So thanks to Maria Jesus, the coordinating nurse for the transplantation programs in La Paz, who recorded this video. So as we said, we are collecting the testimonies in every type of format you want, but the final product would be an ebook. So then in this case, we have the video, but we will transcript what she said. And we will use the video, if she gives her the consent, for instance, for social medias, because that's a way to promote and disseminate this project itself, but also TransplantChild. So it's not useless, let's say, to record the video, even though the video won't be in the final product, because we will use the video in different other ways. And now here I will leave the floor to Licia. Licia's testimony is an example on the other side of a written test since the beginning. So another channel, let's say, of communication, and a testimony who is not following, let's say, question by question our suggestions. So it's an example of how you can freely organize your speech.
Well, thank you. I really appreciated Maria Jesus' contribution. My contribution was different, so here is more personal, but of course, everybody, this is just a model to start, and of course, everybody can choose whether to be, how can I say, recognizable or just being anonymous. I'm Licia. I'm working in the Regina Margherita Children's Hospital in Turin, Italy, in the Department of Paediatric Nephrology. So I'm pediatric nephrologist, and I am responsible for the pediatric kidney transplant and combined kidney liver transplantation program. I'm also a consultant in the other programs for heart, liver, and hematopoietic stem cell programs, transplantation programs in children. So my main activity is the care of children affected by congenital and acquired chronic kidney diseases leading to an organ failure and the need for a substitution of the function with a kidney transplantation. Sometimes I do a lot of prenatal consultations, so sometimes I know the families even before the children are born and share with them all the journey until they reach 18 years old and they get graduated, as you can see here, passing through the disease from the diagnosis, the cures, often through dialysis until transplantation. So the care involves not only the children, but the whole family, their brothers and sisters and their grandparents quite often. Therefore, I have the occasion along this long journey to see them in all the situation as inpatients, outpatients for a long period, and now always with adolescents, particularly through WhatsApp messages and mails. Next, every time of the day. I started this job in 1990 when I moved to the immunogenetic research laboratories where I was working. I was doing research on monoclonal antibodies, and I was working with mice every day. Then I was fed up with mice and cells, which was my job. At that time, we didn't see quite immediate the application of monoclonal antibodies, which I was producing every day. So I decided to move to humans, but taking also advantage of my manual experience in doing things in the very small creatures like puppy mice. So I chose children and nephrology for not throwing away my immunology background. So basically, I arrived to children because they were small, and to transplantation and nephrology, just not to throw away my immunology background. And I enjoyed all the aspects of this job, but certainly what I still maintain is the passion for science and new technologies to improve people's lives. So I like dealing with machines, and I like dealing with technologies just to offer better chances of life. Next. So what I was surprised of was actually the human experience of bringing a diseased newborn to become an adult. And what really gives me the highest satisfaction is actually to see an adult who used to be a very small child. Maybe I got him from on dialysis when he was very small, as this guy here, who now sent me the pictures of his son, his newborn. Or the main satisfaction actually is to see the second newborn child, one of the most complex child I ever had in our center. She came from another center with a very complex bone and renal situation when she was about 13. So we transplanted her, and we had to face before transplantation many other interventions on the bones to have her. She was a wheelchair, and to have her walk. She's now a beautiful mother of 2 boys, and she can run around to catch them when one is very small and the other is now 3 years old, and she can walk and run to get the children. So the main satisfaction actually is to see them grow and to become adults and to become parents themselves. And the main recognition of my jobs comes actually on the daily basis from children, because children do not care at all by their exams. They want to eat, and they want to run, and they want to have fun as their peers, and they don't care about creatinine or whatever examination. So I like from children. I would never go back to adults, because children are really an injection of emotions and of sprint and of joy of life. And this actually is not exactly what you can find working with ancient people or working with the adults. And so this is actually a great value of our job. But there are also some very important difficulties, which is like communicating bad prognosis, like end of life, when there's nothing else you can do. And it happened to me, as to everybody. For instance, after a PTLD, which was resistant to all treatments, after a long journey of newborn and having the success of a working transplant, and then ending the life for a resistant PTLD. This was very, very hard. I still, after many years I'm working with children, still very, very big difficulties in dealing with death, for instance. And sometimes I find myself in getting support in the parents of the dying child or the death child, and this is something that sometimes still surprises me. But sometimes I find parents and patients stronger than me, or brothers of these children stronger than me, and they were supportive. And I realized that they were supportive with me more than I was able to be supportive with them, probably. And this is something that maybe with sensation that we can share. And one one episode that was particularly difficult and stressing and negative for me. On the other side, is less dramatic, but still dramatic, is that maybe we try to do everything. We invest on a child and their life, and we transplant, and then as soon as they are independent, or if they think that they are independent and they are transitioned to the adults, maybe they take their own way. And one of this girl I was really affectionate to, because she was a child living in an institution and without parents. She was very unfortunately, but then she completely stopped all therapies, and she developed a horrible rejection, non-responsive to any therapy. And so after the second transplant, at the 19, she was again back to dialysis, and she lost after less than 2 years her graft. This was really something was really painful, and which we experience fortunately not very often. But this made me think that probably I did not evaluate her enough, and I did not understand well enough her maturity and responsibility. Gave her the chance to behave as an adult, but she was not, and I was wrong. And so this I feel as defeated for this result. So this situation, fortunately, is not quite often, but it happens. Next. Sometimes I would really have loved in my daily practice is to sit some time with external professionals trained for counseling or job psychologists to discuss how to behave with adolescents, avoiding to be too tight, too loose. Sometimes we try to be with children, with patients, as we did with our personal children, but our children were normal, did not experience any disease probably, and they are not the same. So maybe we can find some help from other professionals. And something I want to tell collaborators, peers, and superiors is that we never dare to say is that we do not work for recognition and compensation. Our work certainly is not even well economically compensated compared to other professionalities. But recognition and acknowledgement of what we do sometimes is gratifying and useful to send over all the difficulties, and even sharing these moments together in the successes, of course, and sometimes also the unsuccesses may be of help. And the next. So I told you my story because I expect that sharing our stories may be of help, and we hope that sharing stories can help to build motivated teams to self-strengthen and self-support, and try to support each other also. Suggesting to build more multidisciplinary teams, allotting time for speaking time is really what is lacking today, but every day in the daily life. But maybe we have to allot some time for speaking and trying to tell freely what we think, and for brainstorm on our difficulties with children and families. Next. So these are the technical issues, which I give the words back to Federica, so she will explain how we organized to collect our testimonies, and hoping to find your favor.
Thank you, Licia. And thank you for sharing your testimony here at the webinar. I think it's a very good example of how you can freely speak. If you find it easier to follow pre-written questions, it's okay. But you see, Licia came up with things we haven't thought, or we haven't come up with. So that's very interesting. What we will do now is to disseminate, first of all, this webinar, the recording of this webinar, and we ask you to share it with your transplantation teams. We will also prepare a sort of, let's say, leaflet or instructions, guidelines on this project to send by email to sum up all we have said. But what we ask you now is to spread this project inside your teams, inside your healthcare providers, or if you have good relationships with colleagues from other centers, please share it with them. We will be collecting your testimonies until the end of January. As I said, send written text, audios or videos to this email, dissemination, what is it called? -transplantchild@googlegroups.com, or you can send it to the usual email at coordination in Madrid, or to me personally. We will be gathering these testimonies, and then we will prepare, the actual product to share with you. Next one. Then, as all for our webinars, that's just a reminder to follow TransplantChild on social media, whatever social media you are following. Go a bit back, sorry. Exactly. To subscribe to the newsletter, because in this way, all those webinars and the projects TransplantChild is developing can be spread, not only among our centers, but among the general public who are following you through social media. And then share with TransplantChild your local and national events in order to be disseminated and to be told across Europe.